Part of me thought, I knew this was coming. The surgery that I had was the best thing I could have had. It set me up for success. It set my body up to be in a better place to go through treatment. Hi, I'm Brooke. Welcome back to my channel. Today I'm sharing part 3 of my cancer diagnosis story. If you haven't watched part 1 and 2, I've linked them in the description below. I left off with heading into surgery for some problems I was having that I thought were related to hemorrhoids and just general pain that I was having. I had a little open wound that wasn't getting better, and I had a skin tag that the doctor identified as something that we could remove surgically. I was at a teaching hospital, and my surgeon, he did have a resident. There were essentially 2 doctors doing the surgery. I come out of surgery, I wake up from anesthesia, and I remember almost right away I said, "Where's my surgeon?" Because of course I want to know, how did it go? What did he see? I want to talk to him. And the nurse said, "He came by earlier when you were first waking up." Well, of course a doctor's going to know. I'm not going to remember that. At some point they told me he might be in another surgery right now. They'll try to locate him. But we're moving towards getting me discharged pretty quickly. And even through the discharge process, they're like, well, can someone go see if they can find him? But in the end, they never found him. And I thought, well, you know, I've had doctors call me before, like at the end of the day. Maybe he's going to call me and give me an update. So I got discharged, I went home, there was no phone call. I went on the portal, it was pretty quickly after, and I said, "Hey, Dr. C, how did surgery go?" Which hopefully indicated to him that, like, I don't know what happened. I don't know what happened in there. Nobody's told me. And shouldn't that be something you want to communicate with your patient? And at the end of the email, I said, "I would appreciate a phone call. Here's my phone number." That is something I would recommend for anyone dealing with their healthcare team. Tell them what you want and lay it out for them. Make it really easy. I wanted a phone call. Here's my phone number. So sure enough, though, over 24 hours after my surgery, he calls me. It sounds like he's in his car on his way home. I said, "Oh, what happened in the surgery?" He basically said everything went well. I told him kind of some of the symptoms I was having post-surgery, about the healing, and he said that's totally normal. And then we ended the phone call with, "Your biopsy results will come back soon." I'm feeling pretty good after the surgery in general. I could tell it went well. And now we're just waiting for the biopsy results. So about 5 days later, I'm sitting at dinner with my partner, my boyfriend, and I get a notification that I have some test results in the portal. I open up the results and I remember seeing anal cancer, malignant, and I pretty quickly closed it. I think what I experienced in the next few moments is what most people experience when they find out they have some sort of cancer. I went through this pretty quick cycle of, you sort of see your life flashing before you. You think, I could die from this. This is horrible. Part of me thought, I knew this was coming. It was pretty devastating. Crying, you know. Devastating for both me and my partner. It was just really hard. Pretty quickly, I thought to myself, I don't have anything that I haven't done in my life that I'm gonna have regrets about. I'm happy. I have everything I've ever wanted. I've been living my life, and that's good. The hardest part was thinking about my kids and what they would go through. I'm sharing this on YouTube because I want people to know, if you have somebody who goes through cancer or you have to go through it yourself, this is what it's like. And maybe that will help you be there for a family member or take care of yourself as you go through a cancer treatment. I'm pretty good about thinking about, what do I need to do right now? What is the next step? I wasn't going to go read my biopsy results. That would be a little triggering. I wanted to talk to my doctor. He called me the next afternoon and said, "We've referred you to Fred Hutch Cancer Center. You know, the good news is anal cancer is very curable these days. So he said the cancer center will be calling you within the next day or so. I immediately called Fred Hutch Cancer Center. So another tip I would have is don't wait for anyone to call you. Just call them. And I was going to be very understanding if they weren't ready to talk to me, but I didn't see any reason to wait. They were really nice. They already had my information. I think it was like an electronic transfer. So she said, yeah, let's get your intake going. She asked me a bunch of questions, and she said the next step for you is getting scans, because, you know, before you go in for your first meeting with an oncology team, they need to know where the cancer is. And she said the scheduling team's going to call you within a day or two. So I waited till the next morning, and then I called to get my scan scheduled. I had to have 3 scans, PET scan, MRI, and CT with contrast. They needed to look from head to toe to see if I had cancer anywhere else. I got all my scans done the following week during spring break, and then I had my meeting with my oncology team the next week. Within 2 weeks, I was meeting with my team. Oh, as my scans came in, I did not look at any of the results. I knew that I wanted to wait and talk to the cancer experts so they could tell me the meaning of it all. I think probably most cancer centers do it this way, but before they met with me, they met as an entire, I think, cross-functional kind of team, and they go over a case and kind of come up with the plan. They did all of that before I went in to meet with them. So going for the appointment, it's very stressful because you don't know what they're gonna say, but pretty quickly the radiation oncologist explained that the cancer was in 2 places in my anal area, one tumor kind of on the outside. So that sore I had that wasn't healing, they call that a tumor. I have another one inside my body that luckily my surgeon had biopsied as well. About my surgeon, the actual surgery that he performed on me was done extremely well. I'm willing to bet once he got into that surgery, he realized we need to make sure we biopsy everything that we should here, because this is not just a hemorrhoid situation. I have a feeling he knew this is different, because once you finally get in there and look, you're gonna see that this isn't just some baby hemorrhoid. I have been saying that when you get diagnosed with cancer and you go to a cancer center, it's like getting on a fast-moving train that doesn't stop. There's so much information and so many resources and things you need to do and appointments. It's just coming in at you because they want to cure your cancer. So they are on a mission, and they have a protocol and they have a process for how they do that. So they shared with me that my treatment plan was 30 radiation appointments that would coincide with taking oral chemotherapy pills, because they work together to cure this type of cancer. This cancer being caused by HPV, the type of cancer it is extremely responsive to that protocol, chemotherapy plus radiation. In addition to that, I had 2 IV infusions of a different chemotherapy drug called mitomycin. That was just another way to get rid of the cancer. The overall treatment would take about 6 weeks. You don't get treatment on the weekend or holidays. The next step really was for my radiation oncologist to come up with the radiation plan, which I found out that's a pretty complex process. She said that she had something about 10 people reviewing the overall plan for how the radiation was going to work. These doctors who dedicate their life to understanding science and helping people, they figure it all out, and along the way they're sharing with me what I need to know, side effects of my medication, how to take the medication. They also told me that I would not lose my hair from the chemotherapy I was taking. And I did cry in that moment. I thought chemotherapy means losing your hair, It doesn't always mean that. Depends on what kind of chemotherapy you have, what kind of cancer you have. There's another important piece. Right before I started treatment, my radiation oncologist took a look at my surgical site, essentially. And that one area that was covered up by the skin tag, that was like a small open wound, I guess you could say, was still healing. It had not healed yet. She was surprised because she didn't realize that was the case. And she was pretty concerned because once you start radiation, your body doesn't really heal the same way. I mean, you're going through radiation, all of that kind of stops. And if I had an open sore in that area that never healed, that's problematic. So she actually called me one night and said, I need to talk to you because I'm now kind of getting up to speed and I do apologize. She said, I was a little confused. And she said, because you have this open sore, this increases your risk of needing a colostomy bag when we're all said and done with your treatment. And I said, okay. This phone call was just another hit where I had to come to terms with the chance that I would end up having a colostomy bag the rest of my life. So I did some research to kind of alleviate some of my concerns and fears, and I just researched, what does that mean? Can you live a full life? Can you do all the things you want to do? And essentially what I read was, yes, you can. And so I just said, okay, that's just something that could happen. Let's put that off to the side. And I have 1 week before my treatment starts for that area to heal. And the good news is, right before my treatment started, that area that I had the most concerns about, it healed. It healed. Which meant my risk of needing a colostomy bag went way down. And what it also meant was the surgeon, in the end, did an excellent job. So his strength was his surgery skills. And this is where it ended up being a huge benefit to me that he did the surgery. If anyone had done a biopsy on me and not done surgery, not gone in, surgically removed the skin tag, cleaned up the area, set it up to close up and heal on its own, and we found out I had cancer, I do not think anyone would have done surgery. It would have been like, we're leaving it the way it is, and now we're starting treatment. And I think that it would have been way worse. So the surgery that I had was the best thing I could have had. It set my body up to be in a better place to go through treatment. And I still don't know what the outcome will be, but everything feels really good. That surgery was just really good for me. Thanks for watching. That's the end of my cancer diagnosis story. I'll be sharing more about going through treatment, coming out of treatment. I have a lot of recovery to go through, and I look forward to sharing some fun stuff on my channel with you guys, and I appreciate you coming along for the ride, and I appreciate you subscribing. I hope you're able to get some movement in your body today, even if that means stretching out on the sofa. Take care of yourself. Have a good day. Bye.